Oh, okay.
Okay.
Hi everyone, my name is EPayette and I did my senior project on nursing. So last year a CNA class was offered at Goochland High School, not at the high school, but it was after school and on weekends. And I decided just to do it for something fun and new. So I completed the class and I really, really enjoyed it. That right there is me getting my diploma, and that is Dr. Jones, who is my teacher. I also work at the YMCA with kids and Child Watch, and it's something I really enjoy. I love working with kids, and that's how I decided that when I do get older, I do want to pursue a career in pediatric nursing. I want to specialize in pediatric oncology nursing, which is how I thought of my research question. Oncology has a lot to do with cancer, so for my research question, I wanted to know how much cancer affects a person's emotions, especially depression, anxiety, and loneliness. I read a bunch of case studies and I learned a lot about how it does affect their emotions. A lot of the patients do experience lots of sadness as a direct result from having cancer, because it is that life and death situation they're in, which also affects their anxiety. And I also interviewed a few people who family members had cancer. One, Randy Moore, said that his dad was the most lively, happy person that he's ever met in his entire life. But as soon as he was diagnosed with cancer, right along with that came depression and depression medications, and he was just upset all the time, and it just really impacted his life. So in my conclusion, I did come to see that cancer has a direct result of emotions, changes in emotions. I did my internship at Weston Pediatrics. I also that is my doctor, my doctor's office. I go there when I'm sick, when I have a cold, and it was really cool seeing both from the patient perspective when I go there and also from the nursing doctor perspective. That was really interesting. This right here in the middle was my nurse that I interned with. Her name is Miss Thorpe, better known as Nurse Angie. She taught me so much. This is me getting taught about syringes and how to draw medicine into the syringes. I never actually knew that the nurse had to go measure the medicine, put it into the syringe. I always thought that the medicine was shipped to the doctor's office already in the syringe, but it's actually a lot more difficult than you think to do that. I got to practice with that, not actual medicine, but I did get to put water into the syringe, which was cool. We also did a lot of stuff with patients. We cleaned out someone's ear who had an ear infection and a bunch of nasty stuff inside their ear. I got to hold down little tiny month-old babies while they got their shots, which wasn't that fun because they were kicking and screaming and crying, but it was still something I enjoyed. For my second internship, I haven't actually started it yet, but it will be with Dr. Jones, who is also my teacher for my CNA class. She is a nurse anesthetist. So a lot of people probably have had surgery in here before, and you always, before you go under, you meet the anesthesiologist, and probably a lot of people think that that's the person who stays with you in the operation room. It's actually the nurse anesthetist. They're the one who watches your blood pressure, watches your breathing, making sure you're okay, you stay under, you have enough medication. That's her. So I'll be watching her role, but at the same time, I'll be able to watch the surgeon do his job. And I'm really excited about that, to see all the different jobs in the operation room. I haven't actually started this internship yet because it's a lot of paperwork because of patient privacy, and also I have to get a tuberculosis test to make sure that while I'm in the operation room, there's no way that I can get any of the patients an infection, get them sick. For my community service, I'm also working with Dr. Jones. These are her current nursing students, and I'm helping her teach them. And every Saturday, I'm at the nursing home with them, helping them with their skills and getting them one step closer to their state board. This is a few of the students. You can see Madison in here. She talked about doing her CNA class this year. So I helped them with all their stuff, like I said. We went through changing patients, which you have to do in a nursing home because a lot of them can't use the bathroom by themselves. Bed baths, showers, all that stuff. We had to do everything, and I helped them along the way with it. And that was just us discussing the activities that we did during the day. A second part of my community service was fundraising. Jackie and I partnered up together and did a series of fundraisers to raise money for VCU's medical center, specifically the Children's Hospital. And so far we have reached around $500. We plan to do at least one more to hopefully reach a goal of 1,000. And I think this will help the hospital out a lot. It can't buy a lot of stuff and equipment, but it will definitely impact a lot of the patients. This is our mentor. Mr. Newman helped us a lot with planning our fundraisers and getting it approved so that we could sit in the cafeteria and fundraise and sell things and play games, and he helped us a lot with that. My advice to all of you guys who will be seniors next year is don't get discouraged. I know I had a lot of people not even reply to my emails or phone calls. They just didn't even feel the need to say no. They just didn't answer. But eventually you will get that person who does say yes, who believes in you and thinks that you'll be able to do it. For me, I will be going to VCU and applying to their School of Nursing as a freshman. I'm so excited. It's my dream school, and I couldn't imagine myself anywhere else. Any questions?
Kelly, obviously you focused a lot on kids in oncology. Did you find, like, on the emotional impact of cancer, did you find that there were differences between people of different ages or other factors that might influence how they emotionally impact?
For children, I didn't really find much on it, but what I did find is that children, I mean, they're young, they don't really understand if they're at that like young age what's going on, so it's kind of like they do get sad, they don't get to go out and hang out with their friends and play sports like any other kid does, so it does affect them differently, more sadness and depression and loneliness because like I said, they can't hang out with friends, but the anxiety really isn't there as much because they don't know what's going on, they're confused, and so it's mostly loneliness and sadness.
You mentioned that your friend's dad was taking antidepressants and that sort of thing. Is medication the preferred treatment, or is there also counseling, and are there other components of treatment that are just routine because it's predictable that they're going to get depressed?
Actually, the amount of people who do actually like get diagnosed with depression who have cancer is relatively low. It's like 20%. Most people just have extreme sadness and not to the point of depression, but those who do have depression normally do get the antidepressants, and they do counseling, because counseling is really helpful for anyone who has depression. So they get both, and even that though, my friend's dad, he didn't really see much improvement in his dad, even with the counseling that he had and the antidepressants. It was still like so devastating to that patient because I mean it was a life or death situation, and it's kind of hard to be happy again.
You had the anesthetist. How long did you have to practice saying that?
Not long.